thing I want you guys to really concentrate on is the joint above the ankle. So you may feel like the bottom of your foot is the one that is in pain, but I want you to always remember that the entire body is connected. So just because the bottom of your foot is in pain does not mean that the problem isn't originating from above that area, like your calves, the back of your knee, or further down like your big toe. I also want you to throw out any notion that only one specific thing is the cause. Most of the time when I see patients in physical therapy, especially if it's an orthopedic injury like a sore foot, it is 4 to 5 issues that we have to address until the whole system is moving properly. Think of your body like a machine. If one piece of the machine isn't working properly, the machine is still gonna go. But if 10 things aren't working properly, all of a sudden you have a significant issue, and that is like the emergency light, which your brain interprets as pain. You're gonna use my favorite tool called the tiger tail. One thing you really wanna get taken care of is you really wanna roll out these muscles. You wanna go all the way down to the bottom. So you're gonna do the outside, center, inside of your Achilles. You're gonna go all the way up. You also want to do the front of your leg. This is the tibialis anterior region, and this is kind of what people most complain of when they have shin splints. All the muscles that are on the front part of your ankle go down, and a lot of them come right over that top part of the ankle, and they can get really stuck together. So sometimes I'll even come in here to these tendons, these little ropey structures, and I will just wiggle them back and forth. And a lot of times that will open up that dorsiflexion, which can then take some of the stress off the bottom of the foot. Get more behind my knee and support it. You want to do it in different weight bearing statuses. And so I can really get in here and loosen up this muscle. And let me tell you, it doesn't feel super great. It's kind of hard to do a video. I can even have somebody else do this while I'm laying on my stomach. Okay, so if you don't have a tiger tail, what you can also use is a foam roller. What you're gonna do with a foam roller is you're gonna lay it on the floor, and then you can foam roll kind of your whole body with it. If you have heel pain, it is a really, really fantastic idea for you to roll out all of your lower extremity muscle groups, because your tight hips could be changing the way you're walking, which could be putting more pressure through the bottom of your foot and irritating it. To do it on your calves, you are going to hold your body up. So it's kind of a nice little workout. And you can roll both of them out at one time. The most intense is going to be when you cross your leg over. And I want you again to go to the inside, so I'm kind of turning my hips to the right. The center, keeping my hips up. I'm going the whole length too, so I want to do all the way down by my ankle, the middle, and then also all the way up behind my knee, and then I'm going to turn my hips to the left. If you like this video, make sure you subscribe. If you know somebody who has heel pain, foot pain, ankle pain, please share this video with them.